Welcome to a short introduction on decision analysis. My name is Robin, and I am a research associate with the Pragmatic Clinical Trials platform. I will be taking you through the rationale and basic characteristics of decision analysis. After this lecture, you should be able to formulate a decision analysis problem by specifying the objective to be achieved, the relevant variables, and the uncertainties. Apply decision analysis methods for clinical decision-making, healthcare strategies, and public health policies. Understand the basic principles underlying cost-effectiveness analysis. A decision is a choice made between alternative courses of action. Each choice or decision has consequences and involve uncertainties and trade-offs. In complex decisions, it may be difficult to comprehend all the options available and the potential consequences. The purpose of decision analysis is to assist in the comprehension of a problem and to give insight into what variables or features should have a major impact on the decision. Decision analysis provides clarity of action, equanimity, and it allows you to focus on what's important. Decision analysis divides a decision into its components to be analyzed individually and then recombined to form a decision. We need a framework for analyzing decisions and uncertainty. We will use the proactive framework from the book Decision-Making in Health and Medicine, Integrating Evidence and Values. The first step is defining the problem. Charles Kettering, an inventor and former head of research for GM, said, "A problem well stated is half solved." Laying the groundwork to solving a problem is the most important. Effective solutions can only be formulated when directed at the right problem. To help you define the problem, ask a few questions. What is your principal concern? What would happen if you took no immediate action? What are the outcomes you wish to avoid or achieve? Next is to reframe the problem from multiple perspectives. The focus is to broaden your perspective to include affected stakeholders. From your defined problem, how does it affect patients and their families, healthcare professionals, governments, and industry? If you need more information, communicate with affected stakeholders. Next is to clarify objectives. What are you trying to achieve with your decision? Are you trying to prevent an illness from happening or cure a certain disease? Are you trying to slow down disease progression or prevent disease complications? Are you trying to alleviate symptoms or dysfunction? Are you trying to save money? Are you trying to improve quality of life? We need to differentiate between means objectives and fundamental objectives. Often, there are multiple competing objectives. It is important to understand what they are. The means objective is the intermediate goal and is a stepping stone to what we truly value. The fundamental objective is what you want to achieve, for example, improving quality of life, decreasing costs, and improving quality of care for all burdens. To choose the best course of action, you need to know what your alternatives are. A list of potential alternatives can be obtained from websites, textbooks, literature searches, and discussions with colleagues. Potential alternatives can be illustrated using a decision tree. In this example, there are 3 generic alternatives as courses of action. The first is to wait and see, the second is to apply the intervention, and the third is to obtain more information. A square node at the left side of the tree is a decision node. This represents that a decision must be made. Circles at the right side of the tree are chance nodes. These represent the possibilities of each choice. The probability of the events at the chance nodes will depend on the choice of alternatives. Next is to think through the consequences of each alternative and the chances of each event. Consider both long-term and short-term consequences. You need to include potential harms and resource use. For example, burden and discomfort, complications, cost to the healthcare system, and patients. Next is to identify any trade-offs. For example, immediate risk versus long-term prognosis, quality of life versus length of life, health gained versus increased costs. Sometimes, after formulating the problem and identifying potential alternatives, risks, benefits, and value, the best option becomes clear. However, this is not always the case if there are multiple dimensions. Next would be to focus on important differences between alternatives. If you use the balance sheet method, rank the issues in order of importance. If you use the decision tree with probabilities and outcomes, calculate the expected value by folding back the decision tree. The expected value is a way to determine the severity of risk. It incorporates probability and impact and can be interpreted as the anticipated return. Next would be to incorporate other decision goals. These can include both qualitative and quantitative evidence. For example, other considerations may include patient preferences, to avoid the worst-case scenario or to incorporate family expectations. To understand the effects of uncertainty, perform a what-if analysis, also known as a sensitivity analysis. This allows the decision maker to gain insight into what variables influence the analysis. To perform a sensitivity analysis, vary the uncertain variables over a plausible range and calculate the effects of uncertainty on the outcomes. If the outcome is not sensitive to a certain change in parameter value, then the precise value of that parameter is irrelevant. If the outcome does change, then further investigation may be needed. Let's go through an example. Once diagnosis of type 1 diabetes is established, the focus is on restoring euglycemia through insulin therapy and teaching the patient and the family the skills necessary to regulate blood sugar levels. The basic objectives of insulin therapy are 1. To facilitate the metabolism and storage of consumed foods, to normalize hyperglycemia, and 3. To maintain euglycemia during fasting. A common drawback to insulin regimens that tightly control blood sugar levels is iatrogenic hypoglycemia. Multiple daily injections is a gold standard treatment. Continuous subcutaneous insulin infusion allows for more flexibility and precision in glycemic control than multiple daily injections. However, it is more costly. Information on value for money is needed. Scuffman and Carr perform a cost-effectiveness analysis to inform a decision. In this study, the authors are interested in informing a decision. Is continuous subcutaneous insulin infusion a worthwhile investment for patients with type 1 diabetes to improve glycemic control? Is it better than multiple daily injections in reducing hypoglycemic events and diabetic ketoacidosis? For patients, the technology has potential to provide better glycemic control, reduce the frequency and/or duration of hypoglycemic events, increase the flexibility of lifestyle, reduce the amount of insulin used, and potentially reduce the risk of ketoacidosis. For government funders, the pump technology and its related supplies are expensive and not all patients will benefit. For health professionals and healthcare workers, the technology requires care teams to assess the appropriateness of patients for the technology and to ensure proper functioning and use. The immediate objective of continuous subcutaneous insulin infusion is to improve glycemic control of patients with type 1 diabetes. The fundamental objective is to improve patients' quality of life, increase lifestyle flexibility, reduce the number of hypoglycemic events and ketoacidosis events, and reduce healthcare utilization. In our example, there are 2 alternatives: multiple daily injections, the gold standard for the management of type 1 diabetes, and the technology in question, continuous subcutaneous insulin infusion. Potential consequences of poorly managed diabetes include hypoglycemic events, diabetic ketoacidosis, death, and these are all associated with higher costs. Table 1 from the paper presents the key parameters used in the model. These parameters are used to estimate the probabilities of a hypoglycemic event, a diabetic ketoacidosis event, death, and the probabilities of being admitted to a hospital and an emergency department. Table 2 from the paper presents the costs of the pump technology, including consumables and insulin. The table also includes the costs of a hospital visit, emergency department visit, and paramedic costs. So what are the potential benefits of the pump technology? They include flexibility of lifestyle, improved glycemic control, and a potential reduction in the number of hypoglycemic events. Potential harms include technology failure, increased risk for ketoacidosis, and it is more expensive than multiple daily injections. The authors use a decision tree to illustrate the consequences of each alternative. The authors calculate the average cost and benefits of each technology. Continuous subcutaneous insulin infusion costs an average of £9,514 per patient, and a patient on average can expect 7.32 quality-adjusted life years. Multiple daily injections cost an average of £4,052 per patient, and a patient on average can expect 6.85 quality-adjusted life years. Comparing the two technologies together, continuous subcutaneous insulin infusion costs an additional £5,462 and is associated with 0.48 more quality-adjusted life years when compared to multiple daily injections. The incremental cost-effectiveness ratio was calculated to be £11,461 per quality-adjusted life year. The authors perform a sensitivity analysis by varying each parameter within a reasonable range to see how it affects the incremental cost-effectiveness ratio. From the analysis, two dominant factors were identified. The first one was additional utility from continuous subcutaneous insulin infusion, and the second is a rate of hypoglycemic events. The study shows that there is a small group that could have substantial benefit from continuous subcutaneous insulin infusion, and another group where the benefits are negligible. High rates of hypoglycemic events is not sufficient criteria for continuous subcutaneous insulin infusion. The patient must be suitable. They must be motivated to maintain good glycemic control, and the risk of discontinuation of therapy must be small. The authors conclude that screening of patients is recommended to identify appropriate potential users. Decision analysis simplifies decision-making by focusing on specific aspects important to stakeholders. Decision analysis allows for comparison of all alternatives, enables prioritization of objectives and values, and overcomes cognitive biases and limitations. A problem well stated is half solved. Decision analysis allows for clear goals and objectives, helps stakeholders understand the current evidence base, and allows for clarity of action.